Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our second conversation for today. Of course, we've had some segments lined up helping us to focus on the issues as we head into the general elections come next Wednesday. Now, we've talked about the economy and we've talked about education. We have to, of course, talk about health. And here to have this conversation with us this morning, we're joined by Dr. Fernando Cuellar, who is an internist at Belize Medical Associates, and Dr. Lisa Johnson, who is the Dean of the Faculty of Health Sciences at the University of Belize. Good morning.
Good morning, Marlene.
All right, lovely to have you on with us and ready to tackle a really important topic. I don't know if there's ever been an election where health is such a priority as a part of the conversation, and we need to start talking about things that we should be paying attention to and key issues that need to be addressed. So let's just dive right into it. Let's start with Dr. Johnson. When you look at health being on the ballot come next Wednesday, from your perspective as a physician and educator, what are some of the critical topics that you know need to be addressed?
Well, the obvious topic, thank you, Marlene, the obvious topic is, of course, COVID-19. Yeah. But when one's looking, have an entire overview of the country, we really ought to divide it up into different aspects of the healthcare sector. First of all, I believe that there should be a task force that is dealing with COVID-19 and COVID-19 alone. Then you have the other parts of the government, of the Ministry of Health, of the health sector in general, that will address delivering regular care, primary health care, secondary health care, tertiary health care, and so on. I would further divide that up into public health and hospital medicine. Public health has its place, it has its role with primary health care and some secondary health care, but hospital medicine needs to have its own devotees and its own set of experts that are paying attention to that. I think we need a division of labor, and then we will be, each important area will get addressed as it should get addressed.
Yeah.
So while COVID occupies us in just about every facet of life, we cannot lose sight of the fact that other services need to be delivered at the same time. And we have to figure out a way how to do that before the services get affected, not after. We need to be proactive in our planning rather than reactive.
Yeah, absolutely. Dr. Cuellar?
Yes, morning. Definitely continuing what Dr. Johnson has mentioned, COVID has only has peeled away what has been happening in the health sector for decades now. It's no secret that our health system has been standing on one foot, and COVID has knocked that foot out. So we're not on any foot right now. We need to demand from the political directorate that our Minister of Health has some type of health background. It's not even a request at this moment, it's a demand. Just like how our Attorney General needs to have some training in law, we need to have the head of the snake, the leadership. We have seen over years leadership voids that would direct the health system. So we need that combination of the minister, and we have to say the minister in healthcare, because the way how our laws is set up, you would hear that the minister shall and the minister will. Mm-hmm. So I know I'll get an argument that we don't necessarily need a health sector. We probably, a minister, maybe a good manager can do that. But given our health laws, we need the Minister of Health to have a good health background.
Yeah.
That coupled with a CEO that could work as that good manager, I'm sure that the leadership in health will be as good as it can get and direct the health sector overall. Dr. Johnson touched, for example, on key things, public health, primary care. The vehicle to do that is through the NHI, that can provide the whole primary care and some secondary care throughout the country. We cannot duplicate efforts, having NHI on one side and the GOB on the other side, and have cross-lap of services be given. So I think the NHI countrywide should provide that good primary health. We can piggyback on that whole rural health system we had with rural health nurses. We can provide from the very smaller communities and work way up. I definitely have the experience in working with government for 15 years in different capacities in clinical and administrative at Carl Huchner, at the district medical officer. I know, for example, how Orange Rock should be set up. Each district has its own uniqueness, but definitely when proper leadership is given, you can make that plan. I definitely agree with what she said just now about that task force, and that is a critique I have right now, that we have Dr. Mann's shouldering everything, and he should have already, or at least the organization through a task force to attack COVID, which will involve both public and private care, to address this problem. We have had numerous consultations. This isn't my opinion. This is real multi-million-dollar opinions through contracts, through thing about health reform, about regionalization. We need to strengthen our regions. We need to go from the pilot project that was developed, where we have the boards. Carl Huchner board was actually a pilot project. We should have a board for each region so that they manage, so that our districts, our health delivery in every sector can be continuous. We don't want an 8 to 4. We don't want a woman to be sent from Punta Gorda to Carl Huchner just to have a C-section. And these things are doable. These things are very doable. We need to develop the infrastructure support. We need to have our hospitals redone. We need our community clinics to be redone. And yes, I know the whole cry that it takes money, but if we want to do it, we can find the money for doing it. We need a secondary, tertiary hospital in Belmopan. I was disappointed that PAHO gave the okay that Carl Huchner's structure was good. It's not good. We need to develop that. We need to develop our human resources, and I think through what Doctor is involved with right now with the university is a part of it. But we need to develop over the next 2 years a plan for human resources, GPs, specialists, subspecialists to provide health. We can't have one person be sent from Stan Creek to have a board being fixed, a non-displaced fracture being fixed way to Carl Huchner. It's very expensive. Yeah. Okay, we don't need a person to be sent from Cayo to have a appendectomy at Carl Huchner when that can be done in the region. Yeah. So it will all go back to somebody put in the head of the stake place, the leadership, to know exactly what they are faced with. And I always want to say this. We've had experts coming. For example, I can remember we've had an English person come in to run Carl Huchner, and this health sector is a beast of its own. Yeah. You have to know the intricacies of how our health sector is unique compared to the rest of the world. Yes, we can copy examples from the rest of the world, but we have to know our diagnosis of health and how to help it. Yeah. And the day won't be enough for me to continue talking.
I was going to say, so that's already a lot to unpack from both of you, and I want to try to break it down so our viewers who are watching, heading into the polls, will listen and pay attention. So we have
less corruption in the, pharmaceuticals, in supplies, infrastructure. We need to be transparent. We need to have processes and protocols when to refer, when to access different services. So there's a lot to do. Yeah. There's a huge.
And let me unpack that. Let me unpack that to the short term first, and then we'll talk about some of the long term. The short term, of course, and I think on everybody's mind, is being able to get through the COVID pandemic to the point where vaccination is available and we return to whatever normal life will be after that. Dr. Johnson, you spoke of a COVID-specific task force. Do you want to differentiate for me how that would be different from what we had with the National Oversight Committee, and also about some of the critical decisions that are to come, given what we know about the pandemic?
This task force would be made up solely of experts in the area.
Okay.
This would be a science-driven and medical expertise-driven task force, both from all the aspects of the health team required to deliver care. So we're not talking only about the representation of tertiary level physicians, but also nurses and pharmacists and the medical laboratory experts that we have in country already. And so this will not, I view this as too much of an important thing that comes and goes, or should come and go and wax and wane with the status of the government. This, or the status of the politics of the government. It should be solely about science and the necessary scientific and prudent steps to take with the health sector as we continue to try and deal with this issue. We seem to make plans either reactively or in the hope that something will turn out to be good. I simply cannot subscribe to that level of thinking as a surgeon, as a trauma surgeon. I have to plan for the worst case scenario. And so if you have not planned and put into effect strategies that address the worst case scenario, you will always be behind. And so there will always be a scramble. There will be a scramble with personnel. There will be a scramble with protective equipment. There will be a scramble with infrastructure and available bed space. We have to sit down, game this thing out, and be ready for the worst turns of the disease. So
the task force, which would be kind of like a science-based group, whether and all people working within the medical field, you envision that they would be able to brainstorm, to evaluate the way forward out of the pandemic. There are many key issues that are going to come up. We're talking about vaccines, which ones will be able to access, how we'll be able to afford it, who will be able to get it. There are always protocols that can be followed that are guided by the World Health Organization and the Pan American Health Organization. Is it also something that you foresee a task force would have to take a look at and make decisions like those?
Well, the task force would certainly have to keep up with the literature that's being produced and the results coming out of the various trials.
Yeah.
Hopefully, with the participation of large global foundations such as the Gates Foundation, the production of a vaccine, when one is approved and one proves itself to have worked and is safe, that the contributions of these global organizations will allow for countries like ours to access a vaccine, relatively inexpensively. Yeah. That is our hope. But we also have to plan for whether or not, how is that market going to look at the time? We can't arrive at the situation and say, oh my God, I didn't know that this was going to happen, or I didn't. We have to start to anticipate what's going to happen down the line. And one of the things that we have to anticipate what's going to happen down the line is that we won't have a good vaccine before the end of next year. Everybody's hanging their hats on the first quarter of 2021. We can't plan as if that is what is going to happen.
Okay, yeah. And if you were to say the looming major decision that whoever comes into office, whoever the new Minister of Health will be and the team that they put together after November 11th, what would be one of the biggest decisions that will have to be made within the short term, that you're kind of keying into finding out what the plans are?
How to definitively deal with increased hospitalizations from COVID.
Okay. Okay. So that's as clear cut as it gets. Let's move from the short term to the medium term. As Dr. Cuellar highlighted, what COVID really did was highlight the deficiencies that already existed in the health sector. It has been a strain in many different areas, from human resources to physical resources. When you look forward, we know that healthcare is expensive. We know that subsidizing healthcare for the public is expensive. What are some of the key things that you pay attention to when decision makers are deciding whether or not you do a full country rollout of NHI, whether you focus on enhancing tertiary level care or the more complicated procedures, or if they're going to do more widespread primary care for people? What are some of the key issues there when you think of the medium term? Dr. Cuellar, let's start with you this time.
Yeah. What you're talking about is health financing.
Yeah.
And definitely that's a huge part to all of this. But I just want to put something out quickly. The way we are doing things may be more expensive than changing. For example, sending a patient from Stan Creek to Carolina to have a C-section is much more expensive than doing that C-section in Stan Creek, for example.
Yeah.
We have our consolidated funds that we get financing from. We need to define packages, what will be relevant to public health, what will be relevant to private health. We need to get the social security more involved. We need to get our private insurances more involved. And I know we got experts far better than me to provide that health financing part to it. Mm-hmm. But we need to develop the infrastructure in health. We need to develop the human resources. And I do not subscribe to any more, that it's too expensive and that it will be helpful, rewarding to the country that in 10 years, in 15 years, we have a more robust, healthier set of Belizeans. It will be cheaper in the longer run. So it may require more steep capital spending right now, but it will turn out better in the long run. Yeah. The sin taxes, we could perhaps, as ridiculous as charge the drug planes for land so that we could get money for help. But there are a lot of things that the people with the proper leadership in health can subscribe to. Mm-hmm. Definitely. When it comes to purchasing, we need to be more transparent of our pharmaceuticals and supplies and that type of thing. Mm-hmm. But yes, health financing and sometimes they like to look at us clinicians as being ignorant to that part of health, but we are pretty much cognizant, especially those of us in the private sector, that if I admit a patient for 2 days or for a certain condition, I need that person to get better within 2 days or 3 days. Mm-hmm. And that is the type of mindset we should have in the public sector also, that everything costs. And for all Belizeans, it costs the same to attend to somebody, to attend to a condition in the public and the private. It just boils down to who is paying for it. Yeah. Okay, if you come in for appendectomy, it costs to take care of that patient the same, because we pretty much get the pharmaceuticals, the doctors are the same, everything is the same. It's just the idea of who's paying for it. When you got the public setting, you probably pay your part, which are $200-300, but the taxpayer they pay the next $3,000. Yeah. But that's the type of difference that I think the mindset should be in the public sector. Get more business orientated. Of course, we do have to have a certain basic net to help those who are not, but you must pay $1 towards or shilling towards your health care. But that's the type of things that we need to instill on.
And, key to being able to offer, whether it is a C-section or getting your appendix out in the north, is looking at human resources. You pointed it out. You know, the private sector uses oftentimes the same specialists that the public sector is using. What about human resources? I mean, is this also an area of attention that has to be looked at? And how do you recruit specialists into our system?
Yeah, definitely. The story still continue. And like I said, I've been practicing for close to 30 years in Belize, and we still hear that somebody is referred to from Orange Rock because the surgeon is on call, but the anesthesiologist is off. So we never have a full team 24/7, and we need to plan for that. It's not hard, Marlene. It's not hard. Yeah. And we can recruit whilst we develop our local, and that's where, for example, Dr. Johnson will help when it comes to education. We can recruit personnel from neighboring countries, give them contracts, for example, and so that if it will take us another 5 years to have 4 surgeons in the north, and so then we do that. Yeah. But it will be cheaper in the long run, and it's doable. We also, like I said, the service packages, we can't embark on everything. So the public health should be able to say, okay, this will be our limit. For example, we don't need the public health to buy an MRI. No, we have one in country, but they can work out a package with the private setting. If certain cancer treatment, for example, we can make deals with Merida and Guatemala to take care of radiotherapy, but really do it, because there's been a lot of lip service so far in these types of care. Cancer. COVID, for example, has enmasked that we don't have an infectious disease specialist, much less a virologist. And we have been talking about infectious disease from the pandemic of AIDS. Yeah. We needed one infectious disease specialist from back then. We even had HIV ambassadors, but we haven't developed an infectious disease specialist. And we don't need one, we need 2. That one go on holiday. So all of these things, the people at the top, and I go right back to the top, to a sensible person at the leadership, okay? We know something about health, and one good manager for plan this thing.
Who'll be in cabinet to lobby for these things as well.
The way how governments have been formed is that the ministers have been given kind of a reward system. You're big and bad in the party, so you'll get the more lucrative ministries, okay? But not enough attention has been, and of course everybody wants a piece of the pie, so I know the educators will cry. So education and health will be vying for the title of who best to look for. Security is another thing, but please, man, health, gonna give more attention to health when it comes to the distribution of the political directorate in Belize.
Dr. Johnson, let me hear your thoughts on the human resource side, because I know that's core to the issue of the faculty that you are now running at UB.
Yes. So, for example, when we look at our nurses, our pharmacists, our medical laboratory technologists, and our social workers, they're also key to the idea of having a social safety net. And so these are professions we have been conducting training in for many, many years. So what the university has pushed regarding these professions, in particular over the last 4 or 5 years, is to elevate what is considered to be the minimum qualification to be a pharmacist, to be a medical laboratory scientist, etc. That had already occurred in nursing, and now it has happened in the other 2 disciplines. And we're also phasing out the associates in social work and moving in that direction. The thing is that what I would want to see is a greater acceptance of standards. Standards have to be in place. Nothing good occurs without standards, certainly not in healthcare. And so as the educational standard and the minimum standard to be a particular type of professional is raised, we have to anticipate that. The country has to anticipate that, and the sector has to anticipate that and move with it, because everything ought to center around patient safety. When we're talking about healthcare, the core of healthcare is patient safety. If you don't have qualified professionals who are maintaining a standard of practice, who are practicing every minute of the day, every second of the minute, you will not have a safe patient. And so if you were to take it from that particular angle, and for me, there is no other angle other than patient safety. And patient safety does not necessarily need millions of dollars. It needs qualified professionals who acknowledge their responsibilities as it relates to the responsibility of care, the responsibility of providing a certain standard. All of that must be in place. You can spend all the money you want if the people who are practicing these professions aren't properly trained and they don't subscribe to patient safety and they do not subscribe to a standard of practice, then the money would have been wasted. So that is very important. What COVID has shown us is that the world can stop literally in a second. Not only can the world stop in a second, your country can cut off in a second. And so it is in our best interest to start to educate doctors for ourselves. And that in and of itself is quite an undertaking. And we are presented with the opportunity to start it off properly and to do it right. And there are accreditation bodies regionally that we ought to subscribe to, and I hope that is the direction we can take medical education in this country.
Yeah. All right. So we looked at quite a bit so far, and we know that any person who takes the leadership of the Ministry of Health after November 11th has a lot on their plate. And it's going to take resources, it's going to take a really good team. And just looking forward, 5 years is a short term. Anyone is just elected for a minimum of 5 years. But there can be things that are laid as foundation for improvements in the long term. So let's talk about that one very quickly as a final point as we wrap up. What are some of the long-term decisions that, while they may seem far off, we need to start thinking of as well?
Well, I would say the support for healthcare professional education in the country, first of all, to be done in country at an international standard. That's one. Two, the occupational health and safety bill will become important. It will affect how Social Security monies are spent, et cetera, et cetera. And yes, it will cause employers some issues because the employer has a certain responsibility as it relates to working conditions and safety equipment for their employees. But those two things will have long-term effects. That we need to legislatively upgrade the standards for all the professions to make sure that people who enter these professions are maintaining a certain standard of education, continuous education, and standard of practice. And we also need a standard that speaks to our healthcare sector infrastructure. We have not paid too much attention to that, but that would have long-term benefits. Unfortunately, a lot of decisions aren't made with that in mind, but there needs to be a good legislative foundation for health sector management and taking into consideration all of the different factors that affect patient safety.
Yeah. All right, Dr. Quer?
Well, I don't know where to start, Marlene, because, short term will affect long term.
Yeah.
But I think it boils down to proper leadership, honestly.
Okay.
People who are knowledgeable of health, knowledgeable of the situation in Belize, surround themselves with good people. We mentioned just now a specific task force for COVID, but we need to think about redesigning the organogram in the Ministry of Health. It's archaic, and we need to do it with a different model of how we go to address the health issues in Belize. We need to go back to regionalization, decentralization. There's a lot of work. But definitely can be done. And it wouldn't be as expensive as one would. You just can't throw up your hand in the air and say it's too expensive. The way we are doing things right now definitely are more expensive than how we can change to better efficiency in the delivery of healthcare. You hear a lot about NHI. It's a good tool, but that's would only cover a certain package of primary care. We need to secondary care, tertiary care. We need to at least make sure that we have functioning secondary care in the regions, and just have, and not for lip service, the tertiary care hospital, both in Belize City and Belmopan. And I know Belmopan, I would be big in getting a tertiary care center for Belmopan because of the hurricane threats every year.
Yeah.
And we need to move away from Kalusha as the only tertiary care. And not tell me, no, it's too expensive, man. Please, don't insult us by telling us that it's too expensive.
Right.
So there's infrastructure development. We need human resources development. Like, for example, I think one of the core things in Belize, the backbone, and it's not any biasness, the backbone to healthcare is the nurses. We need to have one good cadre of nurses, well-trained. Dr. Johnson can look at the syllabus, can look at the curriculum, and see if it's indeed delivering what we need as what was set out in the Caribbean and so forth. Because, for example, I can tell you, the quality of nurses coming out as compared to 20 years is quite different. Their clinical acuities are lesser than before. So everybody look good with high heel shoes and clipboards and so forth. But when it comes to bed care nursing, it's different than before. And she know, and we know that us physicians depend on the nurses 100% to deliver that same safety for and all the other allied. We need people who are trained in X-rays and CTs and even MRIs. We need the lab techs. We need the human resources to be developed. We need health managers. We need to better our acquisitions of pharmaceuticals and supplies, and the processes in delivery of healthcare, like the protocols and so forth.
Yeah, and we can't go through that whole list there, but
No, we can.
but I do have to say, both of you have really given us a lot of food for thought. We hope that our viewers are more attuned to understanding some of the big decisions that are to come for the health sector if we want to see the reform that is necessary, and we can pay better attention too when these promises in the manifestos are made. Thank you very much, Dr. Johnson. Thank you very much, Dr. Cuellar. Please stay safe.
Thank you for having us.
All right. And with that, we are going to go ahead and take a break. When we come back, it's another Meet the Candidate segment, and we're moving up north to Orange Walk South to hear from the representative there. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.